there's a high association between excessive alcohol use and depression and anxiety. With depression, it makes sense, right? People drink for a reason. And I think a lot of people who have depression will drink to self-medicate depression. And of course, most of those people will realize pretty quickly that the alcohol may soothe you in the moment, but in the long run, it's going to make your mood worse because alcohol is a depressant. With anxiety, it also seems natural that people would drink to reduce anxiety. It's very common. And this could be panic attacks, social anxiety, or just obsessive compulsive thinking or any kind of anxiety. It works great in the short run. In the long run, you can get into a pattern of essentially having alcohol withdrawal cause anxiety. And then not only are you treating your shakes and your sweats and your nausea, you're also treating your anxiety. And the anxiety is a rebound from stopping drinking. And then in the long run, excessive alcohol use can lead to dementia. So it can affect your brain both from a mood perspective, anxiety perspective, and also a cognitive perspective.
A lot of times with alcohol use and mental health issues such as anxiety or depression, it's really the chicken or the egg. You know, a lot of times people drink due to anxiety and depression, so they use alcohol to feel better, but in the long run, it actually makes their anxiety and depression worse. Or it's the other way where they're consuming alcohol, and of course, it creates anxiety and depression, and of course, they're consuming much more alcohol. But from a practical treatment level, the most important thing that we need to do is reduce an individual's alcohol use, which is what we do here at Ria. When people are able to reduce their alcohol use, what we have seen and the data shows is that anxiety and depression actually goes down. Also, we get a much better indicator in terms of where the anxiety and depression is coming from, and we can better treat it. We help patients support their mental health by giving them tools where they can measure their mental health outcomes from the beginning, middle, and end of the program. One of the primary tools that we give is a breathalyzer where patients can measure their blood alcohol content. And when people know when it's on a low, medium, high level, they understand the impact it has on their moods and basically their depression and their outcomes when they're in the program. Other ways is that we use evidence-based assessments such as the PHQ-9 and the GAD-7. And these are ways to measure anxiety and depression on an empirical level. And it really empowers patients, but then also the providers, so that way they're all on the same page in terms of how to track their depression and anxiety and have a solid treatment plan. Other things that we do is using the latest assessments, such as the World Health Organization WHO levels. That has been proven that when people move down from 1 or 2 levels, it is a valid tool to help people reduce mental illness episodes and promote overall quality of life. So all of these tools is that we're creating a practical way to track mental health and very similar to like a weight loss program.